and welcome to Health Matters, a program about what matters to you and your health for our listeners here in Central Massachusetts. Health Matters is a collaborative effort of WCCA TV, the People's Channel, you'll find on number 194 on your cable channel, as well as on Roku at Worcester TV. It's done in collaboration with the Worcester District Medical Society. My name is Jay Broadhurst. I'm a family doctor here in Worcester. I actually know a little bit about addiction medicine as well, and it turns out that this evening we are focusing on some special programming for individuals who are affected by substance use disorders. I'm joined by my colleague Meghan Wood. Ms. Wood is a licensed mental health counselor, and she is the clinical director of the Recovery Centers of America Westminster campus. She's been there for between 4 and 5 years, but I do want our listeners to know that you got your master's degree from Assumption University here in Worcester, and I think you've been living and working in the Central Mass area since way back when you got your degree. Mm-hmm. Yep. Well, thank you very much for joining us and being willing to share your expertise.
And thank you for having me. I'm glad to be here.
We've had a number of shows about the opiate crisis and the difficulty that people have sometimes with nicotine and tobacco, therefore alcohol. There are a number of substances that are problematic for folks. But it seems to me that the last 2 years, as we've been dealing with the first emerging COVID epidemic, pandemic, and now as we are beginning to come to grips with living with COVID, those 2 years have not put an end to the problems that people have with substance use disorders. Is that right?
I would absolutely echo that. As a treatment provider here in Massachusetts, we've certainly seen a significant uptick in the numbers of, unfortunately, the number of overdoses and folks who are really struggling, who may not have struggled before the pandemic because they've not had the level of stressors that we're seeing right now. When folks were able to go out and about and do their normal things and have outlets in social lives that help to keep them balanced and healthy. COVID really put a damper on people's ability to keep themselves healthy and well. And we definitely saw folks come in the door for substance use treatment that had never sought treatment before because it wasn't an issue before the pandemic brought these new challenges to them.
Well, I'm eager to take a pretty deep dive into that area, but I wonder if you'd be willing to just share your expertise about the treatments that are available. Mm-hmm. And what I'm thinking about, people have heard of detox. Mm-hmm. Well, many folks are aware that you can go to a hospital and you could be an inpatient, and stuff happens to you. And then sometimes you might go to a skilled nursing facility or a rehabilitation hospital or something. You might have home care. In caring for people with addiction, I think that many of our listeners are aware that there is a detox service that's available in a variety of different places. Mm-hmm. There clearly is outpatient care that's available. There's stuff in between, clinical stabilization services. Now that's something that I'm not sure many of our listeners have heard about. And there are other kinds of programs that are now being advertised as, you can detox and recover at home. So would you be willing just to take a moment with our listeners and describe some of the continuum of care that's available to people who are dealing with these kinds of medical conditions?
Absolutely. So starting from the least intensive levels of care, there are outpatient services, and some of those services have been virtual because of COVID, which has been convenient for people who may not be able to easily get out and about, or they don't feel comfortable being, back in an office setting quite yet. So that could take the form of, once a week therapy or up to 3 times a week, depending on those needs. There is an intensive outpatient level of care, which actually has a group component. So that way they are recovering with a group of peers and trying to really get some helpful tools for sobriety, for mental health, if that's applicable for them. And
Now, I can imagine that intensive outpatient prior to the pandemic would routinely be done together.
yes,
in one
person.
place, in person. But with the pandemic, did that have to go virtual into groups?
A lot of providers did have to go virtual,
Yep.
because they did not have the space to have safe social distancing. And patients also said they didn't feel comfortable being in a space with a lot of other folks that, if they have medical conditions, it's
Right.
very understandable.
Fair enough.
So there are still some places that offer virtual. RCA offers a virtual IOP and also PHP, which would be the next level of more
Well,
intensive care.
So we've talked about outpatient that's individual and the IOP, but what about outpatient? There are self-help groups. I mean, Alcoholics Anonymous has been around for, well, the
Decades.
1930s.
Yep.
And then there are a number of other approaches that tend to all involve a group of people coming together to help each other. How does that fit in on this outpatient side?
So that is typically a recommendation that we have even above and beyond the IOP or individual therapy, because we recognize that recovery doesn't happen in a vacuum. We need to
Right.
have folks around us that are supporting that process. And beyond Alcoholics Anonymous, which is one of the pinnacle group
Right.
self-help groups that are out there, there's also Narcotics Anonymous. We've seen Smart Recovery be another
Right.
venue for folks that maybe feel like they want more structure in those meetings because they actually have agendas and they're facilitated by trained staff. So there are other pathways for folks that may not need an inpatient level of care
Right.
that we'll continue to talk about.
And I'm aware in the primary care world that there are a number of organizations, groups that are now facilitating, say, a group of people living with diabetes, and finding that kind of a group experience. So it really it seems to be something that is helpful for people living with a chronic disease, something that sadly you and I are unlikely to cure, but the whole point is to help somebody who has this disease and it's active, causing problems in their body, causing problems in their life, and helping them get it under control in the same way that they get diabetes under control or asthma under control or something like that. Is that kind of what we're doing here?
Yes.
Okay.
And one piece that is maybe a little bit different than someone who is accessing support for diabetes or another chronic disease is that there's certainly still a stigma that we're seeing attached with
Right.
addiction, despite a lot of education and a lot of strides in this field and in the world recently. It's still one of the most stigmatized conditions that we're trying to help people treat. So
It's a disease that seems to have an awful lot of baggage that comes with it. So we've talked about the individual outpatient, we've talked about an IOP or intensive outpatient kind of thing, and then I think you were going on to other levels of care.
Yep, so beyond an IOP, some folks may need very structured support in the community, and they may need 5 days a week of group and individual therapy to really help get the support that they need for their concerns. For folks that are good candidates for PHP, typically there's a pretty strong mental health component that can also be a barrier in their recovery, so there's a lot of psychiatric support that's built in for that too. So one of the pieces that I wanted to mention that should be a part of the discussion is for medication for addiction treatment. So
Right.
there's
Good point.
certainly a lot of really helpful tools for folks, especially in the early recovery process, which can be the first 3 to 6 months, because there's a lot of urges and cravings and things that can get in the way of them staying on track.
Right.
And so that's an important piece to have, in that conversation when someone's trying to find
So
their
that's
path.
medication-assisted therapy, is there, and people will talk about MAT, and that's what they're talking about.
Yes.
And that seems to be particularly important for people who are dealing with opiate dependence. But it also could apply to people dealing with alcohol.
Correct. Yep. So
What about things like cocaine or?
So for cocaine, that piece is a little bit harder to treat. There are some medications that have been shown to be helpful, but there's not necessarily a consensus that one specific medication does the trick. So, I'm not the medical doctor in the room, so I will say that piece, but there have been some meds that, people have found helpful to address the cocaine urges. And, some of the most popular questions that we get is about naltrexone and Vivitrol, which, can be a daily pill or an injection that really helps to target alcohol cravings or the opiate cravings for folks as well, especially if they've found themselves dabbling with both of those substances.
So this medication-assisted therapy can be part, obviously, of the outpatient world, but we were starting at the least invasive and we're sort of working our way. What are some of the either partial hospitalization or maybe rehabilitation, residential, or up to, when does somebody need to be, and maybe you'll do this at the end, when do they need to be inpatient?
So,
and how do they know that?
That's a great question, because we get a lot of folks calling and they're not sure either. They just know that they need help.
Yeah.
So what we take a look at is, what does their use history look like? Because there's a level that someone reaches where they are physically dependent on a medication or a substance like alcohol. And at that point, we want to make sure that they have the medical support to safely detox off of that medication, or get to a place where they are not using it in any frequency. And so sometimes that's an in-between needing a detox with 24-hour medically managed care. For someone that's not going to have significant withdrawal symptoms, they may only need a stabilization level of care, which is the clinical stabilization that we mentioned earlier. And that's really to make sure that they have 24-hour clinical support to manage their triggers and cues and urges. But that is, kind of the differentiation for inpatient care is really what medically is needed at that point.
Is it possible for somebody to go from, say, a home situation, their own home, into a clinical stabilization, or would they more typically go, for instance, into a detox kind of environment for some number, usually just of a few days, and then perhaps transition? How does it work?
So the majority of our patients will go through detox first, and these are typically folks who are calling us and they know they are not feeling well, they are really having a tough time medically speaking. So I would say the vast majority of our patients will go to detox first, and then we'll step them down. But there are some times where folks may be sober for a long period of time and then call us, hey, I'm a couple days into a lapse or a relapse, and I really just need that help and support. So in a case like that, we could probably look at a CSS for them.
Got it. All right. Let me just take a moment to say to our audience, you're listening to Health Matters. Today we are talking with Meghan Wood, who is the clinical director at the Recovery Centers of America campus in Westminster, Massachusetts, and an expert in caring for people with substance abuse disorders. Meghan, I think we ought to move now to a program which is quite new, if not brand new. I think I saw the press release was about Thanksgiving time in 2021. And I think the name is called Frontline.
That is correct.
And tell us about Frontline. What's this program about and who's it for?
So Frontline is a program specifically built for folks who are medical or behavioral health care professionals. One of the things that became pretty apparent to us as the pandemic continued was that the impact of the mental health and substance use piece for folks in this field was becoming pretty profound, that unfortunately people were struggling to maintain their balance and really manage the stressors on the job of COVID with an already challenging dynamic that we sometimes see. So we were getting a lot of folks coming through our doors that said, hey, I'm a nurse, I'm a therapist, I'm a case manager. It's hard for our population to ask for help when they need it, but we were really, finding this is a pretty consistent theme that people are struggling right now, and so we saw that need, and that's the need that we answered with this program.
So you're targeting primarily people who are in the healthcare field or in the behavioral health field.
Yes.
Is that right?
Mm-hmm. That is correct.
I'm interested that many people have been in their jobs, been asked to be flexible, to pivot, to adapt. Certainly for the people who are in the hospital taking care of folks who are known to have COVID early on, and I think it continues, people are very nervous about that. It's a high stress kind of thing, but as you notice, all of the support people that you've mentioned can be affected by that. But then there are people like teachers, it seems to me, where a school, and whether it's a K through 12 level or a college, the institution seems to be sending a message that says our students are under a great deal of stress, and we really need to do everything we can to make it work for the students. And how can you disagree with that? But what about now, teachers may not be a target for this program. Is that true?
That is true.
Think they could slide in the back door, or you could probably help them?
So we do get folks from a whole range of different professions. We've had folks come in that are from the academic and teaching professions. And what I would say to them is it's like any other job right now. We kind of had our norm for a while, and then 2020 came in, and we're being asked to, as you said, totally pivot in how we're doing things day to day. And change is hard for us as humans. That's just a known fact. And I don't want to minimize the taxation really that all of us have been placed under, because this is our first pandemic and we're still in it. We're not quite all the way through. So
the other groups that have very appropriately received a lot of attention are the people who are kind of referred to as the first responders. People who work ambulances, EMTs, firefighters, the police officers, all of whom get called to situations where they have to act and may well be exposed. Are people like that part of this program? And if not, is there programming that's designed for them at RCA, let's say?
And that's a great question, because sometimes folks will ask, is Frontline first responders and vice versa, because there's a lot of terminology overlap with that. So at RCA in Westminster, we actually have a first responders programming that we already provide.
Oh, okay.
But I will say our numbers have definitely been increasing of folks who are coming and seeking treatment. And again, a lot of that I attribute to COVID based on what they're reporting to us. And there's a lot of overlap, right? There's a lot of weight in the behavioral health care, medical, and first responder field that whether there's COVID or not, we're still expected to show up to our jobs and still expected to help and answer that call when it comes. So there is a lot of overlap with that, but we do actually have specialty programming for them as well.
Got it. People who work in the healthcare professions don't seem to be at the head of the line to ask for help. In fact, I think they feel, understandably, it's their job to help others. So let's say somebody has been hit with issues around substance use, and that now is combined with the stresses of the COVID pandemic. What can they expect coming into a program like this? How would they get there?
That's a great question. We have a couple different ways to empower folks before they even pick up the phone and ask for help, because there's usually a lot of questions about what can I expect, what does this look like if I think I need help. So on our website, which is recoverycentersofamerica.com, we have all of our specialty programming. It includes Frontline, it includes first responders. They can look through, they can see pictures of the facility, because I know a lot of times they want to know, am I going to be comfortable here? Is this an environment I feel safe going into, especially if it's their first time in treatment? And then we also have a 24-hour call center that is able to answer any additional questions that they have, and also will help support, hey, how do I know if I need detox or CSS, or if I'd be appropriate to do IOP in an outpatient setting? So we have staff there to pick up the phone and answer those questions for them at any time.
They can kind of talk through that process.
Yes.
And help narrow what the best, most appropriate options might be.
Mm-hmm.
Is that right? How about confidentiality? Meaning, maybe I don't want my colleagues to know that I'm struggling. I certainly don't want my patients to know that I'm struggling. How do you deal with do you have to, you can't fix it in a day or a week or, I don't know. So what do you say to people?
So confidentiality and working in the field, we know what that is, but there's still always that concern, the what ifs. So, we're just...
What if my patient's in the next room?
Right. So that was part of our initial discussions about Frontline in talking about barriers. What stops someone who is, in a medical or behavioral health care position from seeking help? And that's one of the things right off the bat that we heard. What happens if I walk into a group room and there's someone that I've treated? So that is a piece that we have conversations about very early on, because confidentiality is absolutely key for people seeking treatment. And we are held to the same HIPAA standards that just because someone is in the field of medicine or behavioral health care, that we're still going to maintain their confidentiality. And so that's a very valid question that people have that we answer a lot.
And so the key is their answers to that question, but they're likely going to be tailored pretty much to the individual. Correct. And their particular needs.
Yep.
I'm aware that Recovery Centers of America has the site in Westminster and I think a site in Danvers.
Yes,
but
they do.
You actually have sites in other states as well.
Yes.
So it would be possible for an individual, if that's what made them feel comfortable, to receive care, inpatient or residential care.
Out of state.
Out of state.
If someone says, I really want to have that geographical space, we can absolutely honor that. For example, we have first responder units and our other locations. We really try to be mindful of if that's going to help break down that barrier for that person getting help, we're going to work with them on that.
Given that this is a reasonably special population, and it's interesting to me because I've had conversations on Health Matters about special populations, and most often we're talking about social determinants of health and their impact. This is a population which, on the outside, generally speaking, have jobs, maybe affluent, but they are special. So what are some of the treatment modalities? What are the kinds of things that you have put together at Westminster to try to help these individuals get better, get their disease under control?
So part of the genesis of this was taking a look at direct patient feedback, because we had folks before this program existed that came in, and a lot of the common themes that we heard is, we know self-care is important, and I'm still struggling to make time for that. Thus, having a substance use problem to try to self-medicate some of, the struggles that they're going through. And, then we're kind of uncovering layers of vicarious trauma or even trauma on the job as folks are seeing, the significant impact that COVID has had on our community's health. And
so I need you to stop. You used a term vicarious trauma, and I am not sure I understand that. So help me understand what that means, because if I don't understand it, then some of our listeners may not.
100%. So There are some forms of trauma that we go through because we are directly observing or part of a very dangerous situation or life-threatening situation. And then working in the fields of medicine or behavioral health care, we are working with folks through their own trauma, and we are bearing witness to folks who are suffering, and the impact that that has is very real for us, and it's not always as well recognized by folks who don't necessarily understand the science of what we do day to day.
So when you were caring for those folks in the spring and summer of 2020, and healthcare institutions had locked down because that was the only thing we thought we could do to keep people safe. And that meant that you had somebody who was sick and possibly dying alone. And the only person that they had to come see them was the nurse or the doctor or the therapist or whomever. That's the kind of burden that people wouldn't be able to leave at home.
Yep.
I mean, leave at their work, they'd bring that with them.
Right.
Wow. Well, how can people find out more about this program? What about if you know somebody, I have a friend who has this, and maybe you do have a friend.
So we offer complementary intervention services. A lot of times it's family members who may be accessing our call center to say, hey, my loved one is, let's say a nurse or a doctor, they're really struggling. I just think that they need help, but I don't know how to help them get there.
Right.
So they can call our 1-800-RECOVERY number at any point in time and set up those services, because we know how hard it can be, again, for that person to pick up the phone, but the impact that family and outside supports can have in that process is absolutely essential.
So again, to address some of the barriers that, the individual, but the support system around them, there may be some barriers there, and to provide that support is critically important. Well, this is an extraordinary program that seems to me has been too long in the making, and it's wonderful that your group has put that together.
Thank you.
Thank you so much. My name is Jay Broadhurst. I've been fortunate to be joined by Meghan Wood, who is Clinical Director of Recovery Centers from America in Westminster. We have had an interesting time talking about addiction care for frontline medical and behavioral health folks. Thank you for joining us. I want to thank Frank Rocco, our engineer, and all of the staff here at WCCA TV for their support. Have a great day. We'll see you next time on Health Matters.